All right, so right. So good evening, everyone. Yes, Ganesh, hello, and yes, Indranath Roy. Yes, regarding the general medicine YouTube sessions timetable, that will be there available on the Unacademy learners platform. All right, and in the month of March, sorry, in the month of February, which is about to start from tomorrow, like I will be having 8 sessions of YouTube, and in 8 sessions of the YouTube, each session will be for half an hour, and I will be covering the most difficult topics in general medicine, or I will take up the feedback from you students, whichever the topic you ask me to take, I will be taking those particular topics. Okay. Yes, Indranath Rai, is that clear? All right. Now, let me start the discussion of the congenital heart diseases, like part 2. So yesterday we were discussing the some small tips and tricks to remember the congenital heart diseases. So in which I have discussed, right, so in which I have discussed about the syndromes and as well as associated congenital heart diseases. Now in this particular session I will be taking three important congenital heart diseases, and I will tell you the nutshell points, important points about that particular congenital heart diseases. Right, I will discuss tetralogy of Fallot. I will discuss the atrial septal defect, which is a very common and as well as the very common area where the questions will be asked. And the other important area is PDA, patent ductus arteriosus. So these are the three things which I am about to take for now. Okay, right. So let me start the discussion with the tetralogy of Fallot. So the question is, essential criteria for tetralogy of Fallot includes all except. Any one of you? The options are the valvular stenosis, infundibular stenosis, overriding of aorta, right ventricular hypertrophy. Yes, about the syndromes. Let me tell you the syndromes in the neurology. I have a session today itself at 11 o'clock on Unacademy platform, and that is a free session. All the students can attend that particular session, which is scheduled at 11 o'clock today. And in that, I will be discussing mainly the brainstem syndromes. Right? It is not the session for whom only for the subscribed students. All the students can attend that particular session of that syndromes in neurology. All right. Okay. Right. So essential criteria for the TOF includes all except. Right. So very good, Vinay Yadav and as well as Raghu Verma. So the answer is the valvular stenosis. Right. Now yesterday, like I was discussing, the tetralogy of Fallot means there should be 4 important criteria. Right. There should be 4 important criteria. Now see, sometimes like some of the students may have like confusion to remember all those particular 4 criteria. I will tell you one of the easiest method to remember all that particular criteria, and I'll give you a mnemonic for that, and that particular mnemonic is drop. Right, that particular mnemonic is nothing but your drop. Now what is this particular drop? Let me explain you, or let me tell you. So if you take this particular drop, right, so if you take this particular drop, this includes first and foremost, there will be displaced aorta, right, displaced aorta. Now what do you mean by this displaced aorta? It is nothing but there will be overriding of aorta, right, there will be overriding of aorta. You take the word R. R stands for right ventricular hypertrophy, right? And you take the word O, opening of septum, right? Opening of septum. right? Which particular septum is open? It is interventricular septum which is open, right? It is your interventricular septum which is open, right? What is that? That is nothing but your VSD. Just 1 second. Right. So that is the presence of VSD, that is ventricular septal defect. And you take the word P. P stands for pulmonary stenosis. But what you should remember is, it is not pulmonary valve stenosis which is very common. It is infundibular stenosis which is common. Right? It is infundibular stenosis. Okay, so that is about your the tetralogy of Fallot, that is drop. Now this particular pulmonary stenosis can present in two ways. Now what are those two ways of presentation of pulmonary stenosis? Either there will be infundibular stenosis or there will be pulmonary valve stenosis. Right, there will be pulmonary valve stenosis. But among these two, which is more common? It is infundibular stenosis which is more common, right? And which is the one which is less common? Pulmonary valve stenosis is less common, and the presence of this pulmonary valve stenosis, it is not the essential criteria, right? It is not the essential criteria. Next, the other important point, let me tell you, everyone is aware of tetralogy of Fallot, and everyone is also aware of the pentalogy of Fallot. What is pentalogy of Fallot? It is nothing but, to this particular tetralogy of Fallot, if ASD is added, then it becomes pentalogy of Fallot. But for the most of the students, the confusing area, little difficult to remember, is about the trilogy of Fallot. Right? Trilogy of Fallot. So this is one of the little difficult area for most of the students. What are the components to remember in the trilogy of Fallot? Right. So can anyone tell me what are the components in case of trilogy of Fallot? Right. I will tell you a very easy method. That is the mnemonic. That is PAH. Right. You can remember it as pulmonary artery hypertension. Right. The mnemonic is pulmonary artery hypertension. But it is not pulmonary artery hypertension. So what is the trilogy is? P stands for pulmonary stenosis. A stands for atrial septal defect. H stands for hypertrophy. What particular hypertrophy? Right ventricular hypertrophy. Right? Which particular hypertrophy? Right ventricular hypertrophy. Okay. So this is your trilogy of Fallot. Right? Overriding will not be there. It is your pulmonary stenosis, ASD, and as well as right ventricular hypertrophy. So remember that in the following manner. Next. So the other important thing that you need to remember here is about the physical examination findings in patients with, right, physical examination findings in patients with the tetralogy of Fallot. Okay, now let me discuss the physical examination findings in these patients with the tetralogy of Fallot. So what are these physical examination findings that you should remember is, right, so first and foremost, you should know what will be the clinical examination findings. Right, you should know what are the clinical examination findings. So very important thing, what is that? It is your cyanosis. Right, it is the presence of cyanosis. So cyanosis is a very important feature of the tetralogy of Fallot, because if you take tetralogy of Fallot, it is one of your cyanotic congenital heart disease. Right, it is one of your cyanotic congenital heart disease. Yesterday I have said you 5 T's. 5 T's is for 5 congenital heart diseases. What are those? Tetralogy of Fallot, tricuspid atresia, right? And later I have discussed about, once again, yeah, tetralogy of Fallot, tricuspid atresia. Then I have said you about TGA, transposition of the great arteries. Then I have said you about the truncus arteriosus, right? And later I have said you about the total anomalous pulmonary venous connection, right? Total anomalous pulmonary venous connection. So these are all the cyanotic congenital heart diseases. Now, what are the examination findings in patients with the tetralogy of Fallot? One is cyanosis, and the other important thing is, yes, the other important thing is the presence of clubbing, right? Presence of clubbing. And if you take the arterial pulse will be normal, and if you take the JVP also will be absolutely normal, right? JVP also will be absolutely normal. Now, the very important area that need to be discussed is about the auscultation in case of tetralogy of Fallot, right? About the auscultation in case of tetralogy of Fallot. So if you see the auscultation, first and foremost, what you should comment about, the heart sounds. So first you take the first heart sound. Now let me tell you, in case of tetralogy of Fallot, there is no problem in your mitral valve or neither in case of your tricuspid valve. So that is the reason why your first heart sound will be absolutely normal. Right? First heart sound will be absolutely normal. There will be no problem in the first heart sound. The problem is with your second heart sound. Right? If you take the second heart sound, can anyone tell me what is the abnormality in the second heart sound? What is the abnormality in the second heart sound? Right. So let me tell you that second heart sound, it will be single. And what will be that second heart sound? You will listen only A2. Right? You will listen only A2. Right? P2 is soft. Right? P2 is soft. Why P2 is soft? P2 is soft because of infundibular stenosis or pulmonary valve stenosis. So P2 is either soft or delayed, right? Delayed. And sometimes it may be inaudible as well. Sometimes it may be inaudible as well. So that is about the heart sounds. And the next important thing that you need to discuss is about the murmurs. Right? The other important thing that you need to know in tetralogy of Fallot and auscultation is about the murmurs. Now, what will be the septal defect? Ventricular septal defect. Now, if there is ventricular septal defect and if the flow is from left to right, right? If the flow is from left to right, then in such case, you will have what is called pansystolic murmur. But most of the times what will happen in patients with the tetralogy of Fallot is they will not have left to right shunt. They will have right to left shunt. They will have right to left shunt. Why? Because of infundibular stenosis. Right? Because of infundibular stenosis. So because of infundibular stenosis, what will happen is there will be right ventricular hypertrophy or there will be increase in the right ventricular pressure. Right? There will be increase in the right ventricular pressure. So as the right ventricular pressure increases, the flow will become right to left rather than left to right. So once the flow becomes right to left, that VSD murmur, that pansystolic murmur is absent. That pansystolic murmur will be absent. Then which murmur do they have then? They will have what is called the flow murmur. Right? They will have what is called flow murmur. Now, why do you think they have that particular flow murmur? That is because of infundibular stenosis. Right? Infundibular stenosis. And what are these flow murmurs? These particular flow murmurs, they are systolic murmurs. Right? These flow murmurs, they are systolic murmurs. Is that clear? And where do you hear this? You will hear this systolic murmur in left third intercostal space. Right? Left third intercostal space. Alright. So this is about the murmur what you will have in patients with the tetralogy of Fallot, which is nothing but your systolic murmur. Right? The shunt murmur is absent. What is that shunt murmur? That is your VSD shunt. Right? The shunt murmur is absent. Okay, so this is about the auscultation aspect in patients with the tetralogy of Fallot. First heart sound is normal. Second heart sound, it is a single heart sound. only A2 will be heard, whereas if you take P2, it becomes soft. Why? Because of the stenosis, and it will also be delayed, and it may be inaudible also. And if you take the murmurs, the shunt murmur is absent. They will have only flow murmur, which is nothing but your systolic murmur. Now, coming to the diagnosis. See, when will you suspect the presence of tetralogy of Fallot? Whenever the parent or the mother or the father complains of cyanotic spells, right? Sir, when my baby cries or when I feed my baby, immediately the baby turns to blue, right? The baby will turn to blue, or on exertion while playing, he immediately goes into a squatting position. He will sit down and goes into a squatting position, and then he will be, that blue color whichever was there will come to normal color. That is what is called cyanotic spell. What is cyanotic spell? Whenever the baby cries, or whenever the baby feeds, after feeding, or whenever the individual is under exertion, there will be cyanosis which will develop, right? And that is called cyanotic spell. And that cyanotic spell will reduce upon squatting position. Right? Now, that is a suspicion that makes you to think of tetralogy of Fallot. That is the presence of cyanosis. And when you examine, there will be also presence of clubbing. So what is the first investigation you order? Like if you are in a rural area, X-ray will be there in each and every rural area wherever you are practicing. So if you take an X-ray, the X-ray will show what is called a boot-shaped heart. Right? The X-ray will show a boot-shaped heart. Now, the presence of this particular boot-shaped heart will make you to think of the tetralogy of Fallot. Right? Will make you to think of tetralogy of Fallot. So, once you get it out, what you will do? You will get a 2D echo being done. So, 2D echo will confirm the diagnosis. Right? Two-dimensional echocardiography will confirm the diagnosis. Once you confirm the diagnosis, then you will plan for the management. Right? So, in case of management, like you have palliative therapy and as well as definitive therapy as well. Now, let me tell you what is palliative therapy and what is a definitive therapy. All right? Yes. Answer this question. Blalock and Taussig shunt is done between aorta to pulmonary artery, aorta to pulmonary vein, subclavian artery to pulmonary vein, subclavian vein to artery. Subclavian artery to pulmonary vein. Okay, that is what is answered by Arya. Okay, any other answer? Okay, subclavian artery to pulmonary vein. Yes, Roshan Yadav, you see. Nilanshu Das, C. Any other answer? Raghu Verma? Yes. Vinay Yadav? Everyone are with C. Come out of C. Right. Let me tell you what is the answer here. The answer is aorta to pulmonary artery. Right? Aorta to pulmonary artery. Alright? That is the answer. Answer is A, not the C. Alright? Now, let me explain you why. See, it is a very simple concept. Right? The concept is very simple. Let me explain you that. See, what is happening in these individuals with the tetralogy of Fallot? You listen here. So, see, you don't require to mug up. Listen to the concept. I'll explain you. Now, this is your four-chambered heart. And this is your okay. So, this is your right atrium. This is left atrium. This is right ventricle and this is left ventricle, right? And this is your pulmonary artery, and this is your aorta, right? This is your aorta. All right. Now you see what is happening in patients with the tetralogy of Fallot. There is right ventricular hypertrophy, right? There is right ventricular hypertrophy. Okay, that means the pressure within the right ventricle is very high, and upon that there is also stenosis. There is infundibular stenosis, right? Infundibular stenosis. So thereby what is happening to the blood? The blood from the right ventricle to the pulmonary artery, it is not going. Why? Because there is stenosis there. So the blood is bypassing into the left ventricle. Now because of that, right, because of that, the individual will get cyanotic blood here. In the sense, the deoxygenated blood. What I mean to say is deoxygenated blood. So now your idea is what? Your idea is that what should be your goal? Your goal should be, you should be able to make out that right ventricular blood should enter into the pulmonary artery. That should be your goal. Actually now what is happening? The right ventricular blood is getting mixed up with the left ventricular blood, and that is being supplied to the body. That is being supplied to our body, and that is the reason why the individual will have cyanosis. Now what you want that blood has to be purified. Now what you should do, you have to connect the aorta to the pulmonary artery. So by doing that, what is the advantage? By doing that, the advantage is that the aorta, deoxygenated blood which is there in the aorta will enter into pulmonary artery. They will go into the lungs, they get purified, and then it will enter back into the left side of the heart. That is the advantage of creating a shunt. That is the advantage of creating the shunt. That is a very important point what you should remember, right? That is a very important point what you should remember. Okay. Now many of you were telling like, can aorta to the pulmonary vein, what is the advantage of that? Pulmonary veins are those which will open into the left atrium, right? So if you are connecting aorta and as well as pulmonary vein, what is the use? No use, right? So you have to create, actually during the fetal life, the ductus arteriosus will help for shunting up the blood, but after the birth of the baby, the ductus arteriosus will close. The ductus arteriosus will close. Now you have to create an artificial shunt. You have to create an artificial shunt. That is the palliative therapy, right? That is your palliative therapy. Yes. Now you people tell me, did you understand the concept? All of you. Himani, Roshan, Das, Vinay Yadav, Mohan Sharma, Rahul, Raghuvarma. Did you understand the concept? Right. So now this particular palliative therapy, we have three types of shunts. Right? We have three types of shunts. Now, yes, what are these shunts now? Right? These shunts, they include, number one, BT shunt, right? Next, Potts shunt. Next, the other one is water stun shunt, right? These are the three shunts: BT shunt, Potts shunt, and water stun shunt. Now, you see, the other multiple choice questions that will be asked for you is, in BT shunt, where is the connection between? In Potts shunt, where is the connection between? Water stun shunt, where is the connection between? I will show you an image. That image should get imprinted in your brain. Then you can remember the connections. I'll show you that. You see this image. So if you take this, right, if you take this, first let me show you the water stun shunt. Right, water stun shunt. Okay. I'll just tell you a method to remember, right? Actually, it looks Very odd, but 19 subjects are there. After reading 19 subjects, to remember everything becomes difficult until unless we have some mnemonics to remember. Okay, right. I'll tell you. You take this water shunt. Water, right? So, how do we drink? We drink the water by keeping the bottle above or keeping the glass above. In the sense, like we try to ascend our hand. We try to ascend our hand to drink the water. So now just remember. Okay, before that, the simple concept, let me tell you first. You take water shunt, you take BT shunt, or you take pot shunt. The connections for everything, the connections for everything is with the pulmonary artery. That is a basic concept. That is a basic concept. Now, the only difference is what? The only difference is which part of the aorta. The only difference is which part of the aorta. Okay. So, you take water shunt. What did I tell you? We drink water by ascending our hand upwards. Right? By ascending our hand upwards. So, just remember, water shunt is between ascending aorta and pulmonary artery. Ascending aorta and pulmonary artery. All right. Next, you take the pot shunt. Right. See, like you know that water pot will be there, right? For example, the water pot is there over the floor or over the ground. So what do we do for taking up the water with the glass? We bend downwards, right? We bend downwards. That means we descend downwards to take the glass of water, right? We descend downwards to take the glass of water. So just remember, pot shunt is between descending aorta and pulmonary artery. Descending aorta and pulmonary artery. Right? Now, you take this BT shunt, Blalock-Taussig shunt. Blalock-Taussig shunt. Little difficult. So, Blalock-Taussig shunt, the name itself is very difficult to pronounce. The connection is also difficult. And this particular connection is not with the aorta. The connection is not with the aorta. The connection is with the subclavian artery and pulmonary artery. Subclavian artery and pulmonary artery. Okay, so you see this now. I'll just show you in the image. See, water shunt. This is the ascending aorta, right? And this is your pulmonary artery, right? And you take the pot shunt. This is the descending aorta, and this is your pulmonary artery. Then you take the BT shunt. BT shunt. This is your subclavian artery. This is your pulmonary artery, and this is the shunt. Right, this is the shunt. Yes, guys. How was the mnemonic? Was it little helpful for you? Right. So very easy now. Tetralogy of Fallot is not at all a difficult topic. Components, the mnemonic should be dropped. Auscultation, only one important thing, S2 will be single and you will have flow murmur. And the treatment, palliative therapy and definitive therapy. Palliative therapy, connection between the aorta and pulmonary artery. Aorta and pulmonary artery. So, and the types of palliative therapy, water shunt, BT shunt and as well as pot shunt. Water shunt, ascending aorta and pulmonary artery. BT shunt, subclavian artery and pulmonary artery. Pot shunt, descending aorta and as well as the pulmonary artery. Now, what will be the definitive therapy? See, whatever I said you is was only the palliative therapy. Now, take the definitive therapy. The definitive therapy includes definitive therapy includes number 1, closure of VSD, closure of VSD and correction of infundibular stenosis. right? Correction of infundibular stenosis. All right, so this is about your definitive therapy in case of the tetralogy of Fallot. Okay, so these are some of the very important points. These are some of the very important points related to your tetralogy of Fallot. Right. Right. So I will just wind up this session because at 9:30 you are about to start with another YouTube session by my wife, Dr. Ramyasree, right? And because she will be using the same place to take the class, now I have to vacate the room, right? So I will just stop now. And for some of you, right, for some of you who are asking about the YouTube sessions, right? I'm sorry, you just log into Unacademy platform, that is for the students. There you will be seeing my timetable, right? And even you can also attend the free sessions on that particular platform, right? And those who wants to subscribe, you can use my referral code, that is Raj1769, where you can get appropriate discount for the subscription. Thank you very much and see you in the next sessions.